In Massachusetts' Blackstone Valley, small towns face big gaps: public health, transportation, housing. For years, those gaps went unfilled until the Central Massachusetts Regional Planning Commission stepped in to help build the systems rural communities need.
We saw critical gaps that we have known about for years in transportation access, in healthcare access, and access to housing.
Rural towns across the region often have part-time staff, limited resources, and residents who are isolated from the care they need.
If you think about a small community of 10,000 people in a town in Massachusetts, or smaller, they have very limited staff, sometimes super part-time. All they have is, a fraction of a person for their public health department.
As a regional planning agency, CMRPC plays a unique role, connecting departments, towns, and people in ways that strengthen whole systems.
We're sort of uniquely positioned to bridge silos, right? So linking transportation, aging services, and public health.
Through a partnership with Tri-Valley Inc., CMRPC brought on-demand transportation to the people who needed it most.
Through our partnership with Tri-Valley, we've helped a lot of residents, seniors, access medical appointments, access vaccination appointments, visit the senior center or visit with family or friends, and access wellness programming that they otherwise would have missed.
As rural health services shrink and centralized care grows more distant, access to transportation can mean the difference between care and crisis.
As rural healthcare providers disappear, transportation to them is all the more important.
CMRPC helped towns hire shared staff for the first time, bringing in a community health worker, public health nurse, and more.
In the Blackstone Valley, and that has been a total game changer for these towns. None of them had a service like this before.
CMRPC's Happy Factor project explored how community connection, especially civic participation, can strengthen public health too.
If we're able to reduce barriers, encourage folks to be involved in local government, that it will sort of bolster a sense of community and bring more people to the table, so that it's a sort of broader spectrum of voices being heard in our municipal government.
Through collaboration, both locally and across the state, CMRPC gained not just new partnerships, but new perspectives.
So we, as a sort of newcomer organization to this work, can really benefit from their experience. That network became such a lifeline.
This initiative wasn't just about services, it was about systems, the kind that hold communities together long after the funding ends.
It's funding a system, not a program. The overall goal is strengthening rural infrastructure, and that's a through line. It's building something that's going to be here after the funding expires.
Through connection, care, and community, Central Massachusetts Regional Planning Commission is helping rural Massachusetts become not only stronger, but more resilient. This is the Rural Effect.